All right, party people, we are back at it with another one. Let's get it. So we've got a young adult here with a dry cough, low-grade fever, diffuse crackles. The chest x-ray is showing us findings consistent with Mycoplasma pneumonia. We're not trying to hide it. Now, when a young adult has a fever and some kind of lung pathology, pneumonia immediately comes to the forefront of the differential. But its diffuse nature of the lung findings points us towards atypical pneumonia. Atypical pneumonias like Mycoplasma, Chlamydia, and Legionella, and even viral pneumonias tend to be bilateral. In contrast, classic bacterial pneumonias such as strep pneumo and Staphylococcus aureus are typically lobar pneumonias. Now, can atypical present as lobar? Of course, but in terms of this exam, in terms of your licensing exams, they will usually give you other descriptors if they want to differentiate this factoid. For example, Mycoplasma can present with cold agglutinins. These are IgM antibodies that target red blood cells. This leads to the cold autoimmune hemolytic anemia. So if they give you a 20-something-year-old guy with patchy infiltrate in one lobe, as well as a positive cold agglutinin test, that's Mycoplasma also. But if they just give you a vague, nonspecific presentation of bilateral pneumonia in a young adult, you're thinking Mycoplasma as the most common atypical cause. This is more common than Chlamydia or Legionella. Right now, in terms of what is being presented on the screen to you, we're thinking Mycoplasma. And again, the x-ray is showing bilateral, patchy pattern. Now, if they're asking you to differentiate between gram-positives, gram-negatives, as well as the organism which is causing this particular presentation, we have to break this down. What is the differentiating factor between the gram-positives and gram-negatives as far as Mycoplasma goes? Well, Mycoplasma structurally is unique because it lacks a cell wall. For reference, as a reminder for all you microbiology enthusiasts, peptidoglycan is a major component of bacterial cell walls. Gram-negative bacteria do have peptidoglycan, it's just a thin layer of it. So, just a little review. Gram-negative bacteria have an inner membrane, a thin peptidoglycan cell wall, and an outer membrane. Gram-positive bacteria don't have an outer membrane, instead they have a thick peptidoglycan wall. So both gram-positive and gram-negative bacteria contain peptidoglycan. However, Mycoplasma does not. It lacks peptidoglycan entirely. That's what makes this question so high yield. You have to know that Mycoplasma lacks the cell wall, and this is frequently asked on your licensing exams. So a variation of this question could be a 20-something-year-old dude with pneumonia is treated with amoxicillin and it doesn't work. And they might ask you, why wasn't amoxicillin effective? And the answer is because the organism lacks peptidoglycan. It's Mycoplasma. Now let's run through the other answer choices, giving a little context. As far as lipotecoic acid is a component of gram-positive cell walls. This is something worth knowing. As far as dipocholic acid, this is an interesting distractor. It's found in bacterial spores like those of Clostridium and Bacillus. This helps with heat resistance but has nothing to do with this particular case. Capsule-related proteins, such as polysaccharide capsule or capsular proteins, these are just here for added value. So Bacillus anthracis is the only bacteria with a protein capsule, specifically a poly-D-glutamic acid capsule. Other encapsulated organisms such as H. influenza type B, Neisseria meningitidis, as well as strep pneumo all have polysaccharide capsules. Please note that those patients with splenectomy or autosplenectomy, such as sickle cell patients, are especially vulnerable to encapsulated organisms, hence the need for vaccines targeting these encapsulated bacteria. To recap, let's spin the block. Mycoplasma pneumonia causes walking pneumonia. Findings will be bilateral patchy infiltrates in a young adult who appears otherwise well. It lacks a cell wall and therefore lacks peptidoglycan, making beta-lactams ineffective. Instead of a drug like amoxicillin, you will use azithromycin, a macrolide that inhibits the 50S ribosomal subunit against Mycoplasma. Finally, atypicals like Mycoplasma, Chlamydia, and Legionella are considered neither gram-positive nor gram-negative. You might make an argument and say that they lean towards the gram-negative, but they don't have a typical membrane/cell wall structure, so they are in their own separate category. That's why we call them atypical. All right, that's it for this one. Go crush it.